Well, greetings everyone, and welcome to our presentation on a global perspective on music therapy assessment. My name is Dr. Eric Waldon. I'm an associate professor of music therapy at University of the Pacific in Stockton, California. In addition to being a board certified music therapist, I'm also a clinical psychologist, and I'm licensed here in California. So a lot of my work in assessment has been inspired and informed by my work as a psychologist. And Gustavo?
Hello, everybody. My name is Gustavo Gattino. I'm associate professor in the Department of Communication and Psychology at our University, Denmark. So I teach in the bachelor, master, and PhD music therapy programs at the same university. I'm also a member of the INTAC consortium and also the Danish representative in the European Music Therapy Confederation. It's an honor to be here with all of you.
And I should add that I'm also, my university is a member of IMTAC as well. So, terrific.
So, we would like to present to all of you some definitions, factors influencing assessment approach, also some considerations regarding a database decision-making model. So we want to talk about stages of the music therapy assessment process. And at the end, we would like to have a dialogue with all of you. So when we understand this presentation with the word global, we have three different meanings for the word global. First, when we use the term global, it's because we are presenting an overview about music therapy assessment. The second meaning is because we are presenting different considerations in terms of concepts and definitions on music therapy assessment that could be used in different countries around the globe. And the third meaning is because the term global is connected with an international survey with 928 participants from 9 different languages concerning the topic of music therapy assessment practices. So this survey is organized by the International Music Therapy Assessment Consortium. And during this presentation, we will present some of the preliminary results of this survey.
So it's important to start off with defining some of these terms that we use in assessment in music therapy. And so we'll start here, and I'll be reading these slides in the spirit of making sure that our presentation accommodates all needs. So the first definition is assessment. Information gathering and analysis process used to build a body of knowledge about therapy recipients. And I like to distinguish this from research, where research is also an information gathering and analysis process. However, research adds to generalizable knowledge compared to clinical assessment, which is what we're talking about, which really builds a body of knowledge about a client or perhaps a group. The idea of assessment, clinical assessment, is also applied to all stages of treatment. So the moment you get a referral, the assessment process begins throughout the music therapy treatment process to the point of termination or discharge from music therapy services. So assessment itself is a broad global term, and it's applied to all aspects of the music therapy treatment process. So in the survey that Gustavo had mentioned earlier, we asked music therapists a question. Is clinical assessment a necessary part of the treatment process? And of the 513 participants who responded to this particular question, 94% agreed or strongly agreed that music therapy is an essential part of the music therapy treatment process. The next term is measurement. Measurement is a number, or it's a quantifiable representation of an important clinical phenomenon. I think it's important to note that not all assessment involves measurement. What are some examples of measurement that we might use in assessment? We might use counts, so counting the number of behaviors or responses that we see. We might use weights, distances, or test scores. So not all assessment is measurement, and it's important to realize that measurement is a quantifiable expression. Another term we use in assessment is test. Test is a very specific type of measurement. It's a procedure that might use things like test items or questions or perhaps specific tasks, which produce a quantitative and ultimately interpretable result, and we call these scores. So tests result in scores, and so scores, therefore, are a type of measurement. Gustavo.
Yes. So I also would like to introduce the definition of the term standardized. So when we understand this term, we can also have three different meanings. So the first is regarding how uniform are the assessment items and the procedures. When I understand the procedures, I can include the administering the assessment, interpreting, scoring, or using assessment results. But also, I can understand the term standardized as a transformation of data into a distribution of standardized scores. And also, the third meaning is related with the development of norms. Norm is a statistical concept in psychometrics representing the aggregate responses of a standardized and representative group. So the next concept that I would like to introduce is the concept of reliability, which means the extent to which an assessment procedure consistently gauges or measures a construct or a characteristic. It's also the extent to which an assessment procedure is free of error. For example, the higher the reliability, the lower the error. So tests themselves are not reliable. The scores are referred to as being reliable. Yes. And for sure, we have different kinds of reliability. So we have the test retest reliability, just to test the stability. We also have the inter-rater reliability concerning the judgment consistency. We have also the internal consistency, which measures whether several items that propose to measure the same general construct produce similar scores. And also we have equivalence. So for example, when we use different forms of the same test to expect the same results. And yes, we have now validity that could be understood as the extent to which a test measures what it proposed to assess. So evidence of validity is based on how well it measures the construct in question, the appropriateness of interpretation, the extent to which the procedure yields clinically useful information, and remember, tests themselves are not valid because the scores are referred to as being valid. Yes, so it's important when we understand the different kinds of validity that always we are observing and studying constructs. So construct can be understood as an abstract or hypothetical idea that I can't access directly. So I need a concrete example to assess a specific construct. So constructs are, for example, like communication and creativity. So we have different kinds or forms to study the different validity evidence. So the first is the evidence based on content concerning all the things how the construct is related with the items. So we also have the evidence based on internal structure. So when we understand the structure from a specific test considering different factors. We also have the evidence based on external criteria. So when we compare, for example, the scores of one specific test with another measure that is not measuring the same construct, but is measuring something related, for example. And also we have the evidence based on relationship with other measures. So when we compare, for example, different scores from different tests to see the level of how convergent they are or how discriminant they are using specific kinds of correlations.
Another term we see quite frequently in the allied health professions like music therapy is the term assessment tool. It's any device, product, or procedure used to gather information in a clinical situation. So what are some examples of some assessment tools? Protocols that you might use, list of steps, for example, for assessment. Any assessment or intake forms that you might use when you're first seeing a client. Perhaps they've been admitted to your particular unit. Those would be considered assessment tools. If you're using any electronic devices as a way to gather information, perhaps you use an electronic menu when helping patients identify different types of music that they like to listen to, or tests. So tests themselves are a type of assessment tool. So in our survey, we asked participants whether or not clinical assessment should always involve an assessment tool. And of the 510 respondents who did respond to this particular item, 64.7% agreed or strongly agreed that an assessment tool should always be part of clinical assessment. But again, I will point out that not all assessment tools are tests. They are not the same thing. Remember that a test is a very specific type of assessment tool. A test is something that yields a score. So just because somebody says that they have an assessment tool, it does not mean that it is a test. So here are some assessment tools. We have assessment tools that are not tests on the left-hand side of the screen. Some of these you may be familiar with. There's the magnet survey, which is used with older adults. We have the MTA-ED. It's an assessment tool by Karen Goodman that is used for children and adolescents who have emotional disturbance. We have the SIMTAP, the Special Education Music Therapy Assessment Profile. And we have the RO assessment tool as well. These are assessment tools, but they're not tests. They don't yield scores. But on the right-hand column, we have music therapy tests. These are clinical tools, some of which you may be familiar with. And we have many presenters this weekend who will be talking about their assessment tools. So please do stay tuned. We have the MCAP-ND by John Carpente, the MIDAS by McDermott and colleagues, Wendy McGee and her team, and the Metadoc. We have Thomas Bergman and his team who created the MUSAD, and also SoundStorm and the Voyas. So I'm looking forward to seeing more, staying tuned and hearing more about them and their presentation this weekend. So that's terrific. So we asked our respondents in our survey, we asked them, how frequently are you using assessment tools in your practice? And of the 434 participants who responded to this particular question, we found that 35.7% of those 434 are using music-based assessment tools of some kind. Some of them are tests and some of them are not, either most of the time or always. And then 35% of those respondents indicated that they're using non-music-based tests. So perhaps depression inventories or those types of screeners. And they said most of the time or always. Okay, Gustavo.
Yes, thank you. So now I would like to discuss with you regarding the factors influencing the assessment approach. We have this specific model from Isenberg-Zerda from 1988 that we can see the four main factors that can influence the music therapy practice. So we have music because the way that I use music, so my musical skills, and also how I understand music can influence the way that I can work with a client in terms of how to assess this client. So the population, considering the different populations, I can have different goals, objectives, and also different procedures in my assessment practices. Also concerning the philosophy, so what are how my beliefs, my theoretical and philosophical understandings can affect my way of assess the client, and to sure the institution or the environment where I'm working with this client, how this place or this environment can affect the way that I'm working using the different assessment practices. So now I would like to give you more details and to discuss a little bit this topic with all of you. So yes, so here again we have these four factors, and I would like to discuss each of them. So first of all, we have the music. So if I have some specific skills, okay, I know how to improvise. I have a lot of skills in terms of playing guitar and piano. Maybe I can play in a live interaction with the client, creating music with the person. However, if I have some limitations, perhaps using recorded music can help me to assess better the client because I will be able to pay more attention in the client, not in the music that I need to play, for example. But also, what is important is to define how can I understand the role of music in the music therapy assessment practice? Because I can understand basically the music in the assessment process, the music as a tool or the music as the center of the music therapy assessment process. I can have the music as a tool, for example, when I'm using a song just to prompt one specific behavior that I want to assess in my client. For example, I can play a song and I want to see my client doing some specific gestures. So I can give some cues in the music just to help the client to do some gestures, and I can check if the person can do or not these specific gestures. Also, when you understand the music as a tool in the music therapy assessment process, I can use the music just to promote an interaction between the client and the music therapist. So, for example, I have a musical interaction between the different participants, but I'm not interested in the music. I just use the music to facilitate the interaction, and I want to see exactly what is going on in the interaction and not exactly in the music. So, for example, Kenneth Hagen and John Carpenter, they define, for example, that the APCI, a specific tool for music therapy in families, could be categorized in this specific role because in this specific assessment tool, the music is used to facilitate interaction, and the music therapist will observe what is happening in this interaction among the different family members. But remember, if we have the music as a tool, I can also have the music as a center of the music therapy process in the way that I will assess. So it means that I can separate what is music and what is not part of the musical context because everything is integrated. So the musical experiences, they are the place where everything starts. So I can separate, for example, one behavior from the music because the behavior emerged from the music. It's related with the music. And we have many different assessment tools that they follow exactly this principle. So we have, for example, the improvisation assessment profiles from Kenneth Bruscia. We also have the INCAP from John Carpenti, where the music is part of the process all the time, and everything that is assessed is considered within the musical context. Oh, and we have the second factor. So we have the client population. So it means that when I work with different diagnoses or conditions, I have different things to consider in my assessment. So if I work with a neurotypical adult, perhaps the goals and the objectives that I'm working with, probably I will need more time to evaluate these specific goals because maybe the person will need more time to develop these specific goals. However, if I'm working with autistic child, for example, and I want to see what is going on every week, so maybe I will use a different strategy, and also the specific domains or areas that I will assess will be different considering the different conditions or populations. Also, the institution will influence a lot the way that we assess. So, for example, if I'm working in an institution that has specific requirements and documents to fill out regarding the assessment practices, I will need to be adapt using these specific documents. Also, if in the institution I have some specific goals to work with a client or with a group of clients, I need to follow what the institution is asking me. And also, I need to consider what the institution is following in terms of theoretical framework. So, for example, I have many colleagues now working in Brazil that they work in behavioral institutions. So they need to understand the paradigm from the behavioral approach. So they need to understand the definitions, how they understand behaviors and different things. So for sure, I'm not saying that when we go in an institution, we need to reject all of our beliefs, but we need to adapt them just to have a deal concerning what I believe in terms of assessment and what the institution is asking. And the last one, the theoretical and the philosophical framework. So when we understand different frames, I'm talking here about the beliefs from the therapist, how the therapist understands different concepts about life, about many different things, but also what are the specific theoretical frameworks or paradigms that this person is following. So, for example, we can understand, first of all, that when we work with a client, I need to understand. So I'm considering a neurotypical understanding that there is a diagnosis, there is a specific thing to change. And I need, for example, to see people exactly decreasing symptoms and trying to have this person as close as possible to this typical development. Or I can have my understanding in the neurodivergent paradigm, where I can understand that it's not possible to say what is normal, that there is no normalization, that we need to relative the concept of ableism. And in this sense, I will see what I'm assessing in a different perspective because I have a different understanding about the human being and not only about a diagnosis or a specific pathology. And as we could see here, also we have different theoretical and philosophical approaches when we consider the different models, approaches, and orientations in music therapy. So, for example, now I would like to give you some examples about how we can understand differently the music therapy assessment. So, for example, in the GIM, model, we have the understanding that the uses verbal discourse before, during, and after imagination travels. So assessment of the individual physical and emotional reactions during the travel, as well to analyze the mandalas elaborated throughout the process. So we have this example from GIM, but for example, in the feminist perspectives in music therapy, we have the performed assessment for the collaborative perspective and need to consider each person as unique within their current condition and the different facets of their own history. In the free improvisation model from Juliette Alvin, we have that the assessment is the musical information according to the different types of responses, instrumental, listening, vocal, from other areas from the sessions. But we have something completely different here in the behavioral music therapy, where we have the assessment of the behaviors or behavior patterns. These patterns, behaviors can be assessed in their natural environment or within the music therapy session. So if we consider the Nordoff-Robbins music therapy model that we heard in the previous presentation, we have the assessment of the relationships between the music therapist and the user, of musical communication, social interaction, of the musical responses experienced within the process. If we consider the model of music therapy in DIR floor time from John Carpenti, so we have the assessment from the use of musical interactions and responses at different levels, especially considering musical emotional aspects, cognitive and perception aspects, as well as preferences, perceptual efficiency, self-regulation for emotional responses. When we take the aesthetic music therapy model from Colin Lee, we have something a bit different, even in a musical center model. It's the understanding of the evaluation process from the use of improvisation with musical dialogue as the main element of study. And when we see, for example, the psychodynamic music therapy, it's a completely different understanding because assessment from a subjective perspective, where analysis and interpretation are fundamental to understand the different dynamics and experiences of this process. And just finalizing this list with three other specific uh, understandings about music therapy assessment. So we have the family-centered music therapy, which understands the inter and interpersonal relationships within the family context. The family is understood as a complex organism within different systems where these systems interact and can generate new systems from the flow of interactions. So in the community music therapy, even that we don't have too many reports regarding how they understand assessment. So we have this one, assessment of groups from the problems and possibilities of music and health in society from a psychosocial cultural perspective centered on the musical cultivation of personal and social well-being. And to finish this really broad view on this topic, we have neurologic music therapy that has this understanding of monitor the level of functioning of the user during the therapy process and direct the choice of forms of treatment.
And just I want to point out, right before we continue, we'll be handling all of your questions at the end during our dialogue. All right. So let's talk about a data-based decision-making model in music therapy. So a data-based decision-making model, and one of the things that I have found in my work as a music therapist, and one of the reasons I decided to pursue my doctorate in psychology, is that within music therapy, we spend a lot of time talking about treatments and models of treatment and interventions. And so we do spend a lot of time on that. And that makes a lot of sense because that's often what attracts people to the profession. It's using music as a way to make a difference in people's lives. And so we do spend a lot of time talking about treatment and models of treatment and frames, et cetera. We don't spend as much time talking about models or frameworks for assessment. We spend less time on that. And again, I think that's quite understandable. And so what we're doing here is we're presenting the database decision-making model as a frame to understand how music therapy assessment works across the entire treatment process. So how do we define a database decision-making model? Database decision-making in music therapy involves an ongoing process of collecting, analyzing, and evaluating information to inform important decisions and actions across treatment. So we're going to be looking at this database decision-making model more, but there are three characteristics that we're going to be diving into. The first one is that a database decision-making model involves a multi-method assessment approach. That means we're using 4 different ways of collecting information to build that body of knowledge about our clients. We're looking at different types of evidence, and we're combining those types of evidence to make important clinical decisions, whether we're talking about the referral, perhaps initial assessment, how we go about planning treatment, how we implement treatment, or ultimately how we evaluate an entire course of treatment. We're looking at different forms or levels of evidence. Another characteristic of a database model is that assessment is ongoing. We're always collecting information. It doesn't stop. And we make an assumption that collecting data in this way is a form of assessment, and it's ongoing. And then finally, a third characteristic of a database model is that it's cyclical, meaning data that you collect at one point in the treatment process can be used, if necessary, to go back to a previous stage. And what you're doing is you're justifying moving from one stage back and forth within the treatment process to another based on the data that you are collecting from multiple sources or in multiple ways. So let's talk a little bit more about it. Let's talk about these assessment methods first. So the first assessment method is reviewing. Okay, so reviewing is a part of assessment. So reviewing involves looking at client records, whether that's in a hospital setting, perhaps it's in a school setting, looking at student files. It also involves looking at the research literature, getting smart about the clinical population that you're working with. Or perhaps it's work samples. Maybe they're artworks, or maybe they're song lyrics, they're improvisations. They might be recordings of pieces that clients have composed. So in our survey that we are referring to, of the 440 respondents who answered this particular question, these respondents in their assessment process, either most of the time or every time, involve some form of reviewing. 58.2% of those participants said that they used reviewing as part of their assessment process. Okay, so reviewing is the first assessment method. The second one is interviewing. Okay, Gustavo, you want to talk a little bit about that?
Yes, sure. So when we consider interviewing, we are dealing with different kinds of interviews because we can have a non-structured interview, we can have a semi-structured interview, and we have a really structured interview when we have really specific questions for the client, family, or other professionals. If we consider the results from our survey from 437 participants, most of every time used specific kinds of interviews, we have exactly 69.3% of the respondents. So what is really interesting, because normally we use interviews, especially in the referral part of the music therapy process.
And then Gustavo, maybe say something about the use of translators or interpreters as part of interviewing.
Yes, this is extremely relevant because when we consider all the assessment process, we need to consider the specific cultural and social differences regarding people that will participate in an interview. So for this reason, it's so important that the interview forms, they need to be translated following exactly the specific adaptations for different cultural issues.
Great. Observing. So these could be structured observations. They could be unstructured observations. These could be observations of client responses in different settings or under different conditions. I know that some assessment processes, what they do specifically is that they observe a client's responses under a music condition and then compare that to a non-music condition. So in our survey, 94.5% of our respondents said that they use observations, particularly of musical behaviors, most of the time or every time. And then testing. Gustavo.
Yes, when we consider testing, we include here scales, inventories, checklists, rubrics, everything related with scores. And it's important to highlight that we can have tests that they have the music as a center, that they are based on music, but also we have non-music based tests. And if we consider our results from 172 participants, they said that most of or every time they use tests. So from these participants, we have about 35 to 35.7% of these participants using tests. It's also interesting to see the difference that we have between the use of observing and testing from this survey.
So when we talk about assessment, assessment is a collection of processes that we're doing that involves reviewing, interviewing, observing, and testing. And I think something that's important is that not all assessment involves testing, or not all assessment involves simply observations. Assessment in music therapy involves all of these methods. And if you think about it, we really are using these throughout all of treatment at some point. So we take evidence collected through these 4 different approaches, these 4 different methods. And it's with these methods that we're using, we're making clinical decisions. We're making clinical decisions from the moment that you get a referral to the moment someone may be discharged from treatment. We keep talking about these music therapy stages throughout this music therapy process. And I think it's important to outline what those are. And what are those treatment stages in a database decision-making model? And so they're here. Referral and acceptance is the first one, followed by initial assessment, planning, implementation, and evaluation and termination. Okay. Now, these are based off of the American Music Therapy Association standards of clinical practice, where each of these are defined. And so we'll be talking a little bit more about these, especially as we look to see how do the assessment methods and these treatment stages overlap with one another. So this is the full model, the full database decision-making model. And again, in the spirit of accommodation, I will be describing this image. So what we have here are the 5 stages, each represented by a different box, and they're arranged in a descending stair step form. The first stage, the first stair step, is referral. The second one is initial assessment. The third descending stair step is planning. The fourth is implementation. And the final stair step is termination. So in the referral stage, this is where we are first collecting the information about a client for whom a specific need or set of needs have been identified. During this stage, we're using reviewing, interviewing, observing, and testing as a way to determine whether or not this person would benefit from music therapy services. So you can see that reviewing, interviewing, observing, and testing plays a role at the referral stage. And from now on, I'll be referring to reviewing, interviewing, observing, and testing as RIOT. That's the acronym. The second stage is initial assessment. This is where we've accepted a referral, and we've made the determination that this person will benefit from music therapy services based on the preliminary information that we have. And so we're using a review of records. We're interviewing the client. Where appropriate, we're also interviewing family members or other members of the interdisciplinary team to continue to collect information. We're making observations of the client's behaviors, of their responses, particularly their responses to music. And perhaps we're using some sort of a measure or a test as a way to further understand the client's situation, and perhaps to provide some preliminary information, maybe some goals that we might be thinking about. The third stage, the planning stage, this is where we are designing therapeutic aims, or what we also call goals and objectives, identifying what we're going to be working on with our clients. We're collaborating with our clients or other stakeholders that might be appropriate. We're involving the interdisciplinary team when there's one available. And we're also designing interventions. And we're designing these interventions based off of both the strengths and some of the needs that we've identified during initial assessment. This moves on to implementation. This is where we designed our interventions, and we're now implementing a treatment plan. And throughout implementation, we're reviewing, we're interviewing, observing and testing. We're collecting information to make a determination about how is our client responding to the interventions? How are they responding to the treatment that we're providing? And then we move to termination. Termination, or discharge from treatment. This is where we are looking back and evaluating an entire course of treatment. And we're also looking ahead. We're looking ahead to see what additional treatment may be necessary. Perhaps we'll come to this stage and we'll determine that maybe discharge from music therapy services is not appropriate. And so what we do is we move back to a previous stage. Perhaps we continue with implementation. And again, we're using RIOT as a way to justify any of these treatment decisions as we move from one stage to another. So we asked in our survey, to what extent are you using assessment during these different treatment stages? So for referral and acceptance, 74.3% of our respondents indicated that they do use some form of assessment during referral and acceptance. With regard to initial assessment, how many music therapists are engaging in some form of initial assessment process? And 83.5% of our respondents indicated that they do engage in some form of formalized initial assessment process, which may involve reviewing, interviewing, observing, or testing. I know I said I'd be using RIOT, but I just keep saying reviewing, interviewing, observing, and testing. Just get into that mode. How many music therapists in our survey indicated that they included some form of assessment, or assessment was involved in the planning stage? And we had 89.6% who said to some extent or more. During implementation, how many music therapists used some form of assessment method or assessment process in implementation? That would be 85% of our respondents indicated that. And then evaluation and treatment, or in termination of treatment. 69% of the respondents in our survey indicated they involved, or they saw assessment playing some form of a role in termination. So in all, it would appear that music therapists really see assessment playing a significant role during the planning stage, and maybe less so during evaluation and termination. And of course, our argument here is that assessment plays an important role throughout. We are constantly collecting, analyzing, and then applying any data that you're collecting clinically to make these important treatment decisions. Another way of thinking about assessment is, what is the purpose of assessment at different stages? So there are 4 of them. A first assessment purpose is diagnostic. And I know that there will be a discussion later this afternoon. I think Dr. McGee, Dr. Pfeiffer, and also Dr. Storm will be talking about diagnostic assessment But diagnostic assessment largely is occurring in the earlier stages of treatment. And while music therapists, as a general rule, do not confer diagnoses, music therapists are collecting the important information that may be used by the interdisciplinary team who may be charged with making a diagnosis. And because of music's uniqueness, I think we as music therapists make very unique contributions to the diagnostic process. A second type or a second purpose of assessment is prescriptive assessment. This also occurs in the early stages, and the purpose is to plan a course of treatment. So here we're using assessment data as a way to identify strengths and needs. And I would also point out that using interviewing as part of prescriptive treatment, we can ask the client, what do they want to get out of their work with a music therapist? So we're integrating that information as well into the planning stage. Formative assessment is something that occurs during the course of treatment, during implementation. And the purpose here is to monitor a client's responses to intervention. You may not have thought about using interviewing or even reviewing records as a way to monitor a client's response, but both of them can play a really important role during treatment implementation. For example, perhaps as we're implementing an intervention, we notice maybe in testing information, testing data, that their symptoms are actually worsening. Well, we can use interviewing as part of implementation as a way to find out what is the client's perception on why the intervention may not be working. What's going on maybe contextually in their lives that may be affecting how they're responding to a particular intervention. So it's always important to consider all aspects, look at all the tools that we have available to us, look at reviewing, interviewing, observing, and testing as a way to make judgments along with the client about the effectiveness of interventions. And then we have summative assessment. And summative assessment happens towards the end of a course of treatment, okay, near the treatment termination stage. And here's where we're evaluating a course of treatment to inform discharge or aftercare decisions. So aftercare decisions or aftercare planning, it's a term you sometimes use here in the United States, where we're talking about what does follow-up care look like for the client? Does it involve some form of continuing use of music in some way? Sometimes we also use the term evaluative assessment, or we'll even use the word evaluation, something that is occurring towards the end of the treatment process or the assessment process. And that also would fall under summation. So if we look at these four different types or these four purposes of assessment, we can overlay those on top of the database decision-making model. Okay, so again, we're looking at that five-stage, five-stair-step model. And we see that diagnostic and prescriptive assessment is largely occurring during referral, initial assessment, and planning. We find that formative assessment is happening during implementation. And then the summative assessment purpose is largely occurring during the termination stage. So we can see how different assessment purposes, how the treatment stages, and also the different assessment methods, how they all interact with one another. Gustavo.
Yes, thank you. Now I would like to present some considerations about the assessment process, the different stages that we have in the music therapy assessment process. So all different stages that we have, they could be done in each of these different music therapy assessment stages that Eric presented before. So we have in this picture the four main assessment stages. So the stages that we have different tasks when we are assessing a client in music therapy? Well, it's important to say that there are many ways to explain the assessment practices. So this is a model that can also be used for different therapies with different frameworks or theoretical understandings. And also, as I said, you can organize this in a different way. But I believe that this could be applied in many different ways, and also, I want to say that this model was created based on different publications from psychology, social work, and also occupational therapy. I'm happy to say that this model will be part of my new book called Essentials of Music Therapy Assessment that will be published this month until the end of June. It's an ebook, it's an open access ebook, and I will inform about this book in my social media, so Twitter, Facebook, and Instagram. So now introducing this model. So the first thing that we do when we start the music therapy assessment process is about preparation. At this stage, the music therapist has some basic questions to answer that help in his or her preparation. Why assess? What to assess? And how to assess? So normally we define in this specific stage. So what are the demands or the needs for assessment? We also plan exactly what will be the focus, because I can just have my focus in the person, maybe in the different goals that I'm working with this client, and also in some specific content like behaviors, so the different verbal discourse and the musical parameters, for example. And also in the preparation, I need to be aware that I will need to select one or more different assessment methods. So for instance, I can use reviewing, but I can also use at the same time testing because I can combine both of them. So this is the moment for planning exactly the different things that the therapist will do. And also, it's important to consider in the stage of preparation what is the theoretical framework and also the perspective of the therapist, considering the client is something more related with diagnosis perspective or more considering a neurodivergent perspective. It's important to know all of these things before. Because as you could see here, the assessment process is something organized and structured. Okay, so when I define all the preparation, I know exactly what I will do. So I will have the second stage, the data gathering, the moment of applying one or more assessment methods. So the four that Eric presented before, to gather information about the client. This is extremely important because I can do this specific data gathering with the client in the session, but I can also do this specific data gathering, just for example, assessing a specific video or an audio file. I can also have the music score as a way also to assess the client. So when we talk about data gathering, for sure, the first thing that we have in our minds is to be with the client, and I'm assessing the client in the moment of the session. However, sometimes this is not possible, not because the music therapist doesn't want to do this. It's because maybe it could be better to carry out the assessment afterwards, because in the moments of the session, we have many things to think about it. Have many concerns. So maybe could be nice to have this moment of data gathering, analyzing the session afterwards, so assessing the session afterwards, and also, for example, reviewing a music score or a composition from the client. So just checking the lyrics, for example, so you can decide what is the best moment for the data gathering. And the third moment, it's extremely important because it's the moment for analysis, interpretation, and elaboration of the conclusions. So it's the moment to explore the assessed information. So when we think about exploring the information, is everything related with analysis. That could be quantitative, qualitative or a mixed method analysis. So we need to take after or during this specific analysis, also we need to explain this data. So we need to understand this data, and this is the moment of the interpretation where when I will try to explain why I got this specific kind of data. So, and for sure, when I'm talking here about interpretation, I need to consider my clinical practice, all my experiences, my empirical experiences, but also I need to consider my theoretical framework to carry out a good interpretation. And for sure, after the analysis and the interpretation, I need to conclude about the different data and the different results from my assessment practice. So, and we have different conclusions that we need to consider. Sometimes my conclusions, they are related with making decisions, sometimes because I want to know more about the client. So, for example, I just want to understand why the client is doing exactly that behavior so I can understand more about the client. Or sometimes I just need to conclude something because in the preparation part, I did a question because normally in the preparation, I have a question. And in the stage three, I need to answer this question in the conclusion. So, for example, if my question was um, how the music therapy is dealing with some specific difficulties from this client. So I will try to answer this question. But basically, it's about making decisions to accept or reject hypotheses and also to know more about the client or the music therapy process. So, for example, do I need to change the goals that I'm working with this client? So what about the role of these goals in the music therapy process? So maybe I can conclude that this client needs different goals for the music therapy process. Okay, so when I have the analysis, the interpretation, and the conclusions, I have the stage where I will document the different things. So when I will document, this is the moment to elaborate different reports and also to communicate the family members, the staff members, and also I can communicate other professionals from other places. And also, please remember that we have different participants in the music therapy assessment process because I can include the clients, the music therapist or the co-therapist, the family members, and also professionals from other areas. Yes. And after studying all these different four assessment stages, we can see that they are integrated in the previous music therapy assessment stages that Eric presented, because we have in both referral, initial assessment, planning, implementation, and termination, we can have many cycles of these four different stages of assessment. Yes. But sometimes we can apply everything in a really detailed way, and you can ask yourself, oh, but Gustavo, this is not working for me because sometimes I don't have a lot of time for assessment, so it's not exactly the same for me. And this is right because if you have a work with your client just once, so you have only one session, perhaps you need to do the 5 different music therapy stages in one session. Or for example, if you are working with groups that the clients, they are always different. So perhaps you need to establish fixed goals and you will try to have the same way of assessing these clients. Or for example, when you are working with a group of clients that some clients are the same and some clients they are different. So maybe you need to have also a fixed plan considering these specific variations. When you have a really large group of clients, perhaps it's important to focus more in group goals rather than individual goals, because maybe this could help you to consider the music therapy assessment practices in the music therapy process. And for sure, especially now that we have face-to-face and virtual sessions, we also need to consider what will be the focus in terms of assessment in the face-to-face sessions and what will be the differences when I have my client online. Yes, so this is all from my part. So now I would like to invite all of you for our dialogue. So we still have 10 minutes for our dialogue. So Eric, I have some questions here, so I would like to read for everybody. So the first question that we received was from the Dr. Patricia Sabatella, and she asked, why do you consider that the examples you mentioned are music therapy tests? So if you consider the slide where you present all the different tests, so what is the main characteristic that we can define them as tests? So I think that I can't hear you, Eric.
Yep, there we go. So
Yes.
yeah, sorry, but I had muted my microphone for a moment. Um, so I think you're referring to the slide where we were looking at music therapy assessment tools and then music therapy tests.
Exactly.
Um, and the reason I refer to those as tests is, first of all, they all result in a score. So that would qualify them as representing some sort of a quantifiable construct. And maybe the question is also about why would I consider them music therapy tests, where maybe more appropriately they should be referred to as music based, because they all involve music as part of the assessment process. So I don't know if that answered that person's question, or Gustavo, perhaps you have something to add.
Yes, I think that it's important to highlight what you said about the scores. So this is the main difference. Sometimes people they say, okay, I don't use tests because I don't like to use these specific, really well organized forms. And actually, what the person is saying is about assessment tools, because the basic difference is some specific assessment tools. They are tests because they have scores. However, some of them they are not tests because they are not working with scores.
The other thing I'll say about tests is that we don't always need tests as a way to justify what it is that we're doing. I will say my work as a clinical psychologist, I didn't always use tests, and psychologists are known for applying a lot of tests. In fact, the primary assessment method that I would use as a clinical psychologist was really the review of documents and also the clinical interview. And that in of itself can be sufficient. And I also think it's important to point out that of the 4 assessment methods that we outlined here in our presentation, not all 4 are going to be present every time for every client or every group that you work with. They don't all happen in the same sequence. Reviewing does not always proceed. Interviewing precedes observations, precedes testing. Sometimes they happen in different orders. Just as Gustavo was mentioning, there are exceptions to how we conduct assessment in different settings, in acute settings versus a group setting. And what we're doing is we're adapting and we're being flexible, but we're always reviewing, interviewing, and observing and testing as part of assessment.
Yeah, this is interesting because considering my clinical practice, especially with autistic people, I'm using more at this moment observing, because for me it's extremely important to have the opportunity to observe videos and have details, especially in the microanalysis perspective, to consider all the complexity of the person that I'm working with. Because sometimes these scores, they can present many relevant information. However, some things they are missing. So I need to complement this information and to combine this information. I think more and more we are having examples not only in research but also in the clinical practice that people are merging different kinds of data, so using quantitative and qualitative data to try to answer the different questions or needs that we have in the music therapy assessment process.
Mhm. And there's a follow-up in the chat as well, also from Patricia Sabatella. Do you think that scores is the only criteria to define a test? So right off the top of my head, I would say that the presence of a score is a defining characteristic of a test, because tests do result in scores. But I don't know if it's the only defining characteristic of a test. And Gustavo, do you have any thoughts about that?
Yes, because I think it's really important to say that we are using this specific definition not from ourselves. So this is used from other areas like psychology. And this is the main difference. But it's important to highlight that even when we are doing observation procedures, we also can measure something, but this is not the same like a score. For example, I can measure the frequency or the duration of a specific behaviors, but this is not the same as a score. To be a score, it's because I'm applying a specific classification that has a specific meaning about what the person is doing and how the person is responding for a specific situation.
We have 3 minutes left.
Okay, thank you. So we also have another question. Could you elaborate a bit on assessment and the different stages of what you referred to as brief music therapy or the focal music therapy process? Yes, so here it's because sometimes you have only one music therapy session. And normally we have the possibility to assess the client in the 5 different stages. However, when you have only one session, you need to do the referral process, the initial assessment, the planning of the treatment implementation, and also the termination in the same session. So it means that your possibility of assessment will be really concentrated because you need to assess many things at the same time. So many colleagues that they work in this specific environment, for example, people that they work in hospitals, they have a lot of situations like this for focal or brief music therapy. So they elaborate specific forms that at the end of each session, they can fill out some specific questions and they will have a good summary about what happened with that client that will summarize the whole music therapy process.
Yeah, and I would agree with that. I mean, hospital work, I think the mode in a lot of hospital work is one session where it's almost like what we say in the United States, a drive-through music therapy. You may see somebody one time, and so you need to make that maximum impact. So when you're receiving that referral, and you may not have a chance to look at the patient's record the first time you go in. So you're going in, you're observing, you're interviewing, you're determining really based on the needs, based on that referral. And I really emphasize the need for that referral. It's almost like the research question in a study. Your assessment is really spinning off of that initial referral that you're getting. And so that's where you're formulating your questions and you're coming up with treatment hypotheses, if you will, when you're first working with that client. So a lot of these things are happening simultaneously, particularly in an acute setting.
Yeah. So, well, we have 2 minutes left. I hope that we can at least give to Camila a good answer. So she's asking about to what extent music therapy non-test assessment tools can go through a validation standardization process. Can they? Yeah. So in a really short answer, for sure you can check specific things regarding validity and also uniform procedures, even when you are applying observation, reviewing, and intervene in specific procedures and interventions.
Thank you. I'm going to speak up here. Um, Thank you very, very, very much to Dr. Eric Waldon and Dr. Gustavo Gattino.